Celeste is our terrific awardee this year, Director of Community Health for Kaiser Permanente of the Mid-Atlantic States. She's led the way on their local investments in affordable housing, access to healthy food, and advocacy for safe places to walk and bike. She inspires us all to action. Cheryl and others on our team have heard her speak before. I think, I'm certainly know and hope that she will be inspiring us today. Even in recognition of the sobering realities of the challenges we're facing right now. This is a regional award recognizing regional impact, and she is having that impact. She's inspiring others, and it's also been impressive how she and Kaiser have been making these sorts of investments that go far beyond a health clinic into all the other areas that make for healthy living for everyone. So let's have those claps come up, and I'll show Celeste's award, which has been mailed to her.
Thank you.
Cheers to Celeste. And now, Celeste, I will turn the floor over to you. Thank you.
Wonderful, wonderful. Thank you. So can you see me and hear me clearly?
Yes, I can.
Wonderful, wonderful. Well, thank you so much. Thank you to the Coalition for Smarter Growth for choosing me as the awardee. I really appreciate that. This is a wonderful honor, and I want to thank you, Stuart, in particular, for your leadership. As I listen to the work that you all are doing and thinking progressively about smart growth and communities and livable communities, I too am impressed, and I so appreciate our partnership on the work of the Purple Line Coalition, as well as these upcoming Courageous Conversations and other. So thank you again, I really appreciate it. And I appreciate all of you who have taken the time to join us virtually, in spite of the pandemic, in spite of these tumultuous times that we're in now. You all are here, and I appreciate your support, both of me and of the organization. So as Stuart said, this conversation was planned a long time ago, but it is no more timely than now to be talking about health and equity and what we need to be doing as a society and certainly as a community to support the movement. You know, you're really honoring me for work that I absolutely love, work that is core to my belief that everyone should have an opportunity to live a fulfilled, healthy, and productive life. And obviously, as we've seen with much clarity over the last few weeks, we are not there yet. But you know, as painful as these past few weeks have been, and I really do mean painful, they've been very difficult for many of us, especially those of us who are African American. It's been a really tough time, but it has also been a time of encouragement and possibility. As I see the young people out there who are you know, kind of challenging the norm and out there on their feet and really being relentless about changing the status quo, I am encouraged. I do believe that we are at a moment. You've heard many people say that, I'm sure, and I do believe that we want a new normal and that we need a new normal in this society, in this land of promise. So I am encouraged. I'm glad to be in public health in this moment. This is an exciting time for us, and I will say an affirming time, because we certainly know that these things that have now bubbled up to the surface have been going on for a long time, and we have been in it, trying to call attention to it and solutions and create solutions. So, you know, for more than a decade, I've worked for Kaiser Permanente, one of the nation's leading health systems. So, we've dedicated ourselves to improving health, not only in our hospitals and our medical centers, but where people live, work, and play. And that's because zip codes matter. Where you live matters. So Kaiser Permanente provides quality, affordable health care and health coverage, insurance as well, to about 12 million people across the country. And it is our vision that our members and our communities are among the healthiest in the nation. And we come to that vision with a clear understanding that good health is more than the absence of illness. Neighborhood access to healthy foods, safe outdoor spaces, good schools, affordable housing, and more is really what produces health. And so the work that you all do and that we do at Kaiser Permanente to create equitable conditions for people to live well is really, really critical, especially now. So again, I applaud you and I encourage you to continue to do the great work. So I know I have just about 10 minutes and I want to really talk about some of the work that we're doing and really frame it around COVID-19, because I think obviously even before the recent uprisings and the protests, we were in this virus, we were in this health pandemic. And COVID-19 really showed why zip code matters. As we saw the data, we saw the numbers broken down by zip code of where the highest rates of COVID-19 exist. You know, some people were stunned. Some people were shocked by that. We were scratching our heads and trying to understand, why is this happening? And we know why. We know that there are inequities that run long and deep in our communities that make access to some of the basic things that we take for granted, access to those things not for everyone. Food is not available for everyone. Grocery stores are not available in all communities. Job opportunities, as Stuart mentioned, is another area. And so those are all of the things that really lay bare in the midst of COVID-19. So I'm going to talk about some of the work that we're doing in that context. The other thing is that the pandemic and racial equity and social justice, this movement that's emerging, and the work that we do, those things are inseparable. We cannot disconnect them. And I think that we have a real opportunity to integrate them even more. So I'm so glad that you all are interested in doing that through your work. So we saw in COVID-19 that there were huge health and economic disparities. Black and brown communities were getting sicker, dying faster, and with higher hospitalizations. 33% of those who were hospitalized from coronavirus have been Black. Yet, we make up only about 13% of the US population. Black Americans on average are about 30% more likely to have health conditions that exacerbate the effects of COVID-19. These are such as high blood pressure, asthma, chronic kidney disease, and more. 19% of Latinos don't have health insurance, and they're twice as likely to both have and die from diabetes than whites are, making them also more vulnerable to the ravages of COVID-19. So, these impacts are no accident. Our zip codes predicted it. Our zip codes matter. We know also that there was a huge segment of our population that is considered essential workers. These are mostly Black and Latino people who are placing their lives on the front lines and increasing their exposure to viruses, to the virus, not viruses, the virus, in transit, in the workplace, etc. Only about 16% of Latinos and 20% of African Americans can work from home. This is a data point from the Economic Institute. So again, zip code matters. And as a matter of fact, zip code is a stronger predictor of our health and well-being than even our genetic code. So this is why we at Kaiser Permanente do the work that we do. We engage in communities to improve the conditions where people live, work, and play so that we can get to healthier outcomes. So there are 3 areas that perhaps overlap with our work. Maybe 4, because we talked about economic opportunity, but housing, food, education, and economic opportunity. So let's start with housing. Housing has long-standing inequities surrounding it, from redlining to land use to zoning that's resulted in segregation of schools that have lasted till today. There are many neighborhoods across this country, across this region, that are segregated by race, which has a huge impact on the quality of schools, access to basic services, including, as I said before, grocery stores, but also even healthcare. So the lack of access to affordable housing in all neighborhoods is a problem. Lack of affordable housing leads to homelessness. homelessness has a big impact on health. And I will say that homelessness does not mean necessarily that you're living in the streets. Homelessness simply means that you do not have a stable place to live, a place to go home and lay your head every night. So what we do know is that people who are homeless are more likely to get sick from coronavirus and other, more likely to visit the hospital, stay longer, and sometimes never come out. These are huge costs to our healthcare system and to our society. We have to address it. Homeless individuals are 2 to 4 times more likely to require critical care and 2 to 3 more times more likely, as I said before, to get the virus than the general population. I just think that bears some repetition, because I think we really need to sit on that. The other area is food access. So we know that not all neighborhoods have access to healthy food. Some neighborhoods, people have to take transportation 2, 3, 4, and more miles to get to their grocery store. We know we've seen this in neighborhoods in DC and Ward 8. There are too many people who are living far from grocery stores. So at Kaiser Permanente, we have been working in this space to address some of the food desert, as we call them, issues in our communities. And then the last area is healthcare. Healthcare is vital to all forms of life. You know, whether we're at home, whether we're at school, in college, whether we are at in our neighborhood, out at play, having access to health services is extremely important. You know, we are a healthcare organization, and typically a healthcare organization works within the confines of its health centers and its hospitals. But Kaiser Permanente for years has worked outside of our hospitals to improve health in the neighborhoods in which our members and our communities live, because that is the right thing to do. So let me just, I've listed these 3 areas that I really want to zero in on. The last thing I'm going to mention is economics, because I'm not going to get into economics, but economic opportunity is another area that I think is really vital for us to continue to pay attention to, because small businesses are economic drivers for our communities. And it's important for us to support small businesses, help them to grow, and help them to exist in our communities. And we know in COVID-19, we are going to lose a lot of our small businesses, and many of those small businesses are minority owned. So let me just back up for a minute and go back to housing. What is Kaiser Permanente doing in housing? We are extremely proud of our work with you all and with the Purple Line Coalition to produce and preserve affordable housing in the greater Riverdale area. Why are we doing this? Because, as I said, housing first. If you're not housing secure, it's very difficult to be healthy. So we have invested and will continue to invest in ensuring that despite the Purple Line coming into the greater Riverdale area and potentially creating the impacts of gentrification, we want to ensure that the housing units that exist there that are affordable remain affordable. So we will continue to support housing in that area and other parts of DC and Maryland. I think, and Northern Virginia. I think you all heard at some point that Kaiser Permanente invested about $200 million in affordable housing. Those dollars, many of them will be dispersed across the country through a loan fund, but also in other ways that will allow us to invest in creating spaces where all residents have an opportunity to live in the neighborhoods that they want. The next area of food access. What have we been doing in that area for many years? So grocery stores that's a very difficult challenge to get grocery stores in neighborhoods. So Healthy Corner Stores has been an option for us. We have worked with DC Central Kitchen, with DC Greens and others to create healthy corner stores. What does that mean? It means healthy foods in corner stores where you typically get bologna and bacon. Healthy corner stores enables low-income communities to have the option of healthy food, but that's not enough. It's not a full-service grocery store. So as we're thinking about health for our neighborhoods and thriving communities, we have to create more grocery stores. We have to zone for grocery stores, for farmers markets, for urban farms, and more. So Kaiser Permanente will continue to invest in those kinds of solutions and the policies that enable healthy foods to be within a mile of all neighborhoods. So I talked about healthcare access. I'm very excited about a project or a program that we are going to be launching in June. It's internally called Thrive Local. Essentially, it's an integrated healthcare referral system that will allow us to refer our members to social services. One of the deepest problems that people have is that their social needs are not being met. Housing insecurity, food insecurity, transportation, education, job training, etc. Those needs can be met in our healthcare system. We surveyed many of our members who told us clearly that they want us to ask them not only what matters to them, what's the matter with them, but what matters to them. Not only what's the matter with them, but what matters to them. And this is an important distinction because in healthcare, there's a huge distrust of healthcare in the African American community and in many Latino communities as well. And so we have to do better as a health provider to create a healthcare system that really is patient-centered. So some of the work that we've been doing is to meet unmet social needs, create more patient-centered healthcare, and to ensure that when our members show up with needs that we can't address in our system, that we have a referral service that enables them to go out and get their other health needs met. So we'll be launching that network in June. It's a referral system that will work within Kaiser Permanente, but also within our safety net community clinics. So for your purpose, I would really like you all to continue to think about how you're building communities where health services are easily accessible. So I want to just kind of leave you with some actions. I want you to think about a number of things that we think about every day as we work to create thriving and livable communities. One thing is about these courageous conversations. In order to really understand how to lean in on equity and to lean in a way that we create solutions that put community first and that consider the needs of community members, in some cases the special needs of community members, we need to be comfortable with getting uncomfortable in these conversations. So I'm really happy that we're going to be joining you all in these courageous conversations in a way that we can talk about these issues that have hampered many communities of color around access to housing, access to affordable housing, access to quality jobs. I think it's important for us as a community to really engage in these conversations, and I encourage you to step into those conversations and prepare to get uncomfortable, but to know that it's a learning journey that we're taking together. The other thing that I'd like you all to do is to really be advocates for the policies that protect people's basic rights. Affordable housing policies are critical. Land use and zoning policies are critical. Access to health care and all of the practices that enable people to have the right kind of health care where they need it, when they need it, are incredibly important. And we as influencers can lean in on some policy solutions and ensure that we are advocates for the right kinds of policies that support communities in the way that they need to be supported. Zip codes matter. Zip codes matter to our health. Zip codes matter to our long-term well-being, and zip code matters ultimately to our lifespan. How long we live, how well we live, is really tied into this this work that we do around creating livable and healthy communities. So as we kind of lean into this next phase of whatever new normal looks like beyond COVID-19, beyond our this movement that's emerging around us, I really want us to think about what our new normal is. What is our new normal as community builders? How do we step into a space that really changes the trajectory for our friends and neighbors who live around us here in this region? I'm excited to work with you all. I'm excited to hear your questions and to engage you in a conversation in the next few minutes, but I'm most excited to be prepared to engage you in the courageous conversations that we have set up for you in the next several, I guess in the next several months, we'll be having those conversations that were planned for this summer. So I am going to say again, thank you so much. Thank you for this award. Thank you for your support of our healthy and thriving communities. And thank you for considering Kaiser Permanente as a thought partner with you.